Good morning, everyone. So today I want to talk to you about emergency appointments and emergency pre-blocks. Firstly, my name is, for credibility, my name is Khaled. I have been a dentist in Hervey Bay, Queensland for around 20 years. And I run my own dental practice, Lakeside Dental Spa, for around 14 years. And I have a team of associates and oral health therapists, practice managers, hygienists, and dental assistant and front office staff. So emergency pre-blocks are very important to have in your appointment book. So every day, whether you're a solo practice or a multi-chair practice, you should have an emergency or even two pre-blocks in your book. The reason is that if a patient is calling for emergency, especially existing patient, you can see them. If you can't see your existing patient for an emergency, there's a high chance they will go somewhere else and they will never return back to you. Also, if a new patient is looking for relief of pain or have a broken front tooth that's embarrassing them, and you have in your book blocks for those kind of patients, you will be able to grow your practice massively. Now, I have dealt before, and again, those are real life stories that I can share with you. Some associates, sometimes they don't have the bigger picture of practice ownership, and they might request something on the line. Can you please remove my emergency pre-blocks from my book? Because I'm having a patient on the chair, I want to provide their treatment, and for the next week I don't have any appointments available except my emergency pre-block every day. Can I remove those pre-blocks and put patients in those pre-blocks? My answer to that: if you do this routinely, if you start to violate this principle and remove those emergency pre-blocks, and you fill those pre-blocks with your existing patient that require elective treatments that can wait, it can wait, then what will happen is, number one, your existing patient might ring for an emergency and they won't be able to see you, and they will be very upset, or you'll have to run late or stay after 5 or at lunchtime to see those patients. Number two, there's a high chance that once you don't have those emergency pre-blocks, you will lose on seeing a lot of new patients in your area. And then you will lose on converting those new patient emergencies into examinations. And then you will lose on building up your appointment book, and suddenly you will reach a block where your appointment book will start to dry up and become very empty. And once you get to that stage, you will ask the practice owner, how come my appointment book is not filled as it used to be? Is there a way I can build this up again? Why is this practice not having enough new patients? And you start raising those questions. Number three, usually those associates who ask such questions, they don't understand the value of emergency appointments. And they usually get the patient out of emergency and get them out of the door. For me, the best patient you can grow your practice with are not the new patient examination. They are actually the emergency appointments. I'll tell you why. When a patient comes to you in pain, or having a broken front tooth, or having an urgent treatment required, and you manage to get them in your book, and you manage to help them with their problems and add value to their life by relieving this problem from them, they will value your service so much. And those are the best patients that you will convert into a full examination. And after converting them into full examination, you will manage to grow your practice by getting all the referrals of friends and family. So every emergency appointment, you should treat it as a full comprehensive appointment by getting them out of trouble, and then make sure they are concerned enough to seek your service for a full examination. If you are not raising enough concern and getting this patient to convert from an emergency to a full examination, you are doing disservice to your patient. If you want to give your patient the maximum value, you have to look at the big picture and treat the patient comprehensively. What I found with some solo practice owners, if you are saturated with patients and you have extra special skills, you're doing all-on-4, Invisalign, you might not need a high number of emergency appointments. You can survive with minimal amount of emergency pre-blocks, but have pre-blocks for your existing patients, so you don't run late, so your team doesn't feel tired if they have to run till 6 p.m. or run after lunch break or something. But I find solo practice who can't grow their practice from a solo practice to a two-chair. The aim is to grow the practice, but they can't. usually they are very stiff in their mentality about dealing with emergency appointments. They're putting a lot of obstacles. They want to triage patients. They want to choose and pick them up from the phone. They want to ask a lot of questions over the phone and try to understand what kind of problems they have and try to diagnose over the phone before they even book them. They make it a hassle for this patient to come into their book, and they make it very tricky for their staff to book those patients as well. My advice to those solo practices, you have to be very flexible. You need to understand if the patient is calling for emergency appointments, try to get them into your book as soon as possible. We ask 5 simple questions and get them in the book within 2 minutes, and I can share this with you in a different video. Don't put a lot of blocks for those patients to come to your practice. Just get them into your practice. You might have some of those appointments that they might not require any treatment, but you might win them over and transfer them into an existing patient in your practice, or other patient might be even too complex and you'll have to do minimal work until you can book them comprehensively. So if you find this information helpful, please make sure you like and share. If you like to hear more about my contents, please subscribe to my channel so I can grow it and provide you with more content. Thank you very much.